Good afternoon. I'm Ron Taylor, President of the Board of Directors. Welcome to Woven Health's annual award celebration, Changing the Future of Mental Health Care. I've been volunteering as a board member or advisory member for over 10 years. I'm so passionate about Woven because this organization continues to make positive differences in the lives of those individuals living in the communities of Farmers Branch, Carrollton, Addison, Coppell, and Northwest Dallas every day. 2021 has been a very promising and also challenging year. COVID continues to dominate healthcare, whether getting people vaccines, tests, or treatment. COVID has had a devastating impact on our patients, both physical and mental health. To respond to the pandemic, in partnership with the City of Carrollton, we opened a second clinic to serve our patients. I am consistently amazed by the energy and care that our clinic staff and volunteers show every day to make sure that our patients get best in class. Our diverse group of board members are passionate professionals committed to making integrated community healthcare accessible to everyone in the communities we serve. I am proud of our accomplishments this year, so to that we celebrate. But I also know there is so much more to accomplish and so many more people to serve.
At Woven Healthcare, we're completely different from any clinic you've ever been to. Our vision at Woven is that healthy lives build healthy communities.
Woven Health Clinic is a holistic care where every aspect of your health and your life is included and the best quality care is provided.
Woven Health serves people that need healthcare and cannot afford it. So that means the majority of our patients are uninsured, but we also have some patients that are underinsured, meaning they have insurance, but they still can't afford care.
We are integrating all different aspects of their health in one setting.
We treat the whole person. So when you come to our clinic, you get primary care for all the treatment if you're sick, if you have a chronic disease, diabetes, hypertension, people with flu, strep, all of those things you normally go to the doctor for. We also have on-site women's health care. Majority of our patients are women.
Women's health is not readily available. So many women are not able to get their basic checkup. Forget about their other feminine issues, just their regular yearly checkup. There are so many of them, they are not able to get those things.
I absolutely love the mission of this clinic to provide integrated health services. I particularly enjoy doing that for women, that the fact that women's health is incorporated into nutrition services and primary care and behavioral health.
We also have mental health care, on-site counseling for depression, anxiety, and stress.
Mental health itself is a taboo. So many people, they do not want to address it. So just going out and seek mental care is not that easy.
There is such a stigma in mental health that you see a lot of people suffering from all of these issues and they have no way to get help because of the fact that they can't afford it.
And our sweet spot is disease prevention. That is where we make the biggest difference.
Here we help patients by doing meal planning, by changing their dietary intakes. Also we do cooking class, so a lot of patients doesn't know how to cook, so we teach them how to cook. Also, we're not just helping the patient, we're helping the whole family. Like the mom, once the mom change dietary intake, to change for the whole family.
So at Woven, we work on preventing disease. Our patients, if you're low income, you cannot afford to get diabetes or to have a heart attack. So we focus 35% of our resources to stop you from getting those diseases. The biggest strength of Woven Health Clinic is the staff. We do team-based care. Every single member of our team, medical assistant, the front office staff, the registered dietitian, the physicians, the providers, all of them, our accountant, everyone works together to make sure that our patients get the best, highest quality care possible. And the key that makes us really unique is that we build relationships with our patients. And that is what gives us success.
Our patient is being a driver of their own care and we all help them to get there.
The one thing I think is awesome about working here that I've come to know is that 95% of every dollar that comes into our clinic goes to the care of our patients. And I think that is just awesome.
It's comprehensive, It's high quality, and it's very efficient and affordable. Everyone deserves this kind of care.
Let's thank our sponsors for making this event possible. First, thank you to our premier Platinum partners. Thank you to our Platinum partners. Thank you to our Gold level partners. Thank you to our Silver level partners. And thank you to the many that gave at our Bronze level. Also, we want to thank all the organizations that provide ongoing grants and funding to keep Woven Health's doors open. UT Southwestern Medical Center, MetroCrest Hospital Authority, American Heart Association, Texas Women's Foundation. A special thanks to the cities of Farmers Branch, Carrollton, Coppell, and Addison, and to the Civic League and many other churches and local organizations that donate to Woven. Thank you to an important group of medical volunteers that help us deliver quality health care. Each year, Woven Health gives 2 prestigious awards to a person or organization that has had significant positive impact in our community and beyond. We are honored to present our first award, the Heath Community Leadership Award, to Lennox International.
Lennox International has a rich and long history of community engagement. We were founded all the way back 126 years ago in Marshalltown, Iowa, and we've really kept that Midwestern core of values of community involvement and charitable giving throughout the ethos of our culture.
Lennox has a very simple approach to giving. We give to youth, education, the environment, the arts, and health and human services. And in that, we want to give to the communities where we work and live. And so, for example, here in DFW, we know that Woven is doing great things for the local community. We have employees that are involved. We have an employee that's a board member. And so it's a very simple model where we want to engage our employees such that they are proud to work here because of the things that we're doing in the local community.
Health and Human Services is one of the 5 main areas of Lennox charitable giving program. Of course, with Woven Health focus on patient-centered health in the community, we think it fits really well with our concept, because one of the things that Lennox is really values, and it's a big priority for us, is to support the communities in which we live and work.
Employee engagement is really key to our efforts of charitable giving at Lennox International. We want to make sure that we're supporting organizations and we're supporting events that our employees are passionate about and want to be involved in.
We support Woven Health because of the great things that Woven Health is doing in the community. You see the dollars given going directly to people in need. We like that from a giving standpoint. We would prefer to give to where we can make a direct impact in those communities where we work and live.
You know, I'm encouraged by what we've done in the last 6 years that I've been here, but then what makes me even more encouraged and happy about the whole experience is what we have in front of us, because I think this organization is continue to get better, get stronger. Hopefully we'll expand into more clinics in the future to have more of an impact, a broader impact on the community.
It's our honor to give you the 2021 Charles Heath Community Leadership Award.
Thank you very much.
Our second award goes to a medical professional whose outstanding lifetime work and achievements have benefited many. We are honored to award our 2021 Layer Lifetime Achievement Award to Dr. Madhukar Trivedi.
Dr. Trivedi is one of the most passionate people I know about mental health issues. One of the influences Dr. Trivedi brings to the scientific community is his appreciation for simple solutions.
He comes up with with kind of a different perspective and a different approach. It's just so refreshing every time to talk with him.
The kind of research that I've been doing for the last 25 years that has helped us actually change the way depression is diagnosed and treated in the real world, that really often doesn't get immediately used in clinical practice. Woven being one of our major partners in trying to take these findings we have and put it into practice. My real research originally for the many years was divided into two things. One is I was interested in developing evidence-based sequential treatment approaches so that we measure, we monitor, and then change treatment if it doesn't work, so that the goal of treatment for depression is full remission. The second part was to actually make sure that it is not seen as a second-class illness, and therefore we had to really change the pattern so that primary care, where most medical care happens, starts using depression care as part of their normal care.
It is pretty clear to me that Dr. Trivedi is a true advocate for mental health.
One of the things that I most like about working with Madhukar is that he brings a different perspective born out of true intellectual curiosity, married to really insisting on clinical change for real patients now. That's very unique in the field.
Most researchers do their work and it takes 15, 20 years for their research to ever make it to real clinical practice. What the partnership with Woven has done is allowed me to transfer that knowledge into practice right away. So it is a privilege to be able to see the results of your research in real clinical practice.
Dear Madhukar, you clearly deserve this award. I cannot think of a better person to win this award, which is a great recognition of your contributions to patients, communities, and to the field of psychiatry.
Dr. Trivedi, congratulations on this wonderful honor. I'm so grateful to get to work with you on a daily basis.
Madhukar, congratulations from a friend, a colleague, and an admirer of all of your work. This is very, very well deserved.
Mental health is still a taboo. It is as common as blood pressure, diabetes. It's just that not surfacing. Talking about mental health is not easy, especially the population that we serve is really hard. For them, even getting help for their physical health, their general health is hard. Forget about bringing their mental health issue. In some culture, it is still a big taboo. People just don't want to come forward and talk about it.
Woven Health has a unique model because we provide integrated mental health care with their primary care. So it's all in one place.
We are using Vital Signs 6 in our program. It's a wonderful tool where you screen, diagnose, treat, and see their progress for depression, anxiety, and other mental health. Had a tremendous outcome in their mental health as well as their physical health. Mental health is not just limited to medicine. There are so many other aspects that does help to improve their emotion, their mental health. Exercise is one of the biggest one. The other aspect of that is diet. And the third thing that we do have on-site counselor, behavioral health specialist, and that's the biggest help to our patient.
Without coming to Woven, most all of our patients would never be diagnosed. They wouldn't be screened, they wouldn't be diagnosed, and even if they were, they're uninsured. They don't have the resources for treatment. So without Woven, they would not be getting treatment. Our outcomes for treating depression are in the top 5% nationally. So we get very good outcomes. So what that means for our patient is that they actually lead a healthier quality of life. They can work, they can raise their kids, they can get through a day without feeling that super darkness of depression or anxiety.
The way that we provide care at Woven is a holistic care. It's all in one. You come here for your physical health, but we all know your body and your mind is not separate, they're connected. So you address one thing, if you leave the other thing out, it's not gonna do any good. So that concept we have cultivated at Woven, and treating their mental health along with their physical health, along with their preventative measures, all had helped really all across the board for our patient.
That was a really, really dark time because I just didn't know what the hell was going on. I have 4 amazing kiddos. They are my saving grace. Like, they're pretty much the piece of me that I would never ever trade for the world. They changed my life each in all different ways, and I'm very thankful for that. So growing up, I was the youngest out of 4. Just did my own little thing. Always was either my brother's little sister or my sister's little sister. Never really like my own person. Just trying to fit in, trying to be a different person than what I was. I meet this guy and I end up dating, and I have my first child by myself. Shortly after that, I was raped by my kid's father. I didn't tell anybody but my sister and my best friend. And my sister thought I was lying. I really went through like a dark time because I'm pregnant and I'm like, okay, how am I gonna make my life work? I'm gonna have 2 kids and I'm gonna be raising them by myself. Eventually, I really started contemplating like wanting to die. I ended up changing jobs and I'm working at another job, and I meet this guy. 3 years in, I found out I was pregnant with my other son. Right after the baby is born, he almost put me through a wall in the house. Like a week after the baby was born. He is upstairs telling my older kids, you better not ever listen to your mom, she's a dumb. I just kept taking the abuse. Yeah, that was very intense for me. It was like, oh, I'm so sad. I'm not happy in myself. I'm gonna keep searching until I feel happy, until something fulfills me. And so I ended up filling a bunch of voids with stupid stuff. It was really like drinking, smoking, having sex, just kind of trying to cope with what I had went through. Well, me and my sister decided that we were gonna go on a momcation, right? I just need to get away for a little bit, and so I leave and I go to Las Vegas, and I'm like, oh my gosh, I wanna play it for the first time. I'm not gonna miss my kids at all. It's supposed to be the time of our lives, but I'm absolutely miserable. I just wanna go home and be with my kids. When I got home, I gave my kids the biggest hugs ever. And I was like, Mommy missed you, and I'm never gonna leave you guys again. And then a week after that, I called Woven Health, and I was like, I need to get my blood pressure in check. So I went into the doctor, and she's looking at my blood pressure like, girl, we're gonna put you on some medicine. She's like, so how do you feel? Like, you know, we have mental health services. And I was like, well, I'm definitely looking into that too. A week later, I was sitting in Lizette's office.
She was very motivated that she did not want her children to have the same kind of relationship history that she did. One thing I always mention to my patients, and it's something I mentioned to KD, is like, if you aren't unable to take care of yourself, how are you going to be there for your children when they need you? Especially if they are going through something that is very traumatic for them. A lot of the time in many cultures, such as the Latino or African American, mental health is not spoken about. Unfortunately, even though it's not spoken about, it still happens. It affects your ability to eat, your motivation to do things. That's how depression will sometimes affect people. Things that they were able to do easily before, just not possible right now because it affects you physically and mentally to the point where some people just can't get out of bed. But because of that stigma, they don't want to reach out for help. When I first met Katie, she was been doing well, and then she got to the point where it was just so overwhelming that she just couldn't handle it anymore. There was just a lot of new stressors. Woven Health Clinic was able to become a support system for KD because she knew what she wanted, just like a lot of our patients know what they want. She is definitely making wonderful strides, and she is becoming that mother that she wants to be, that wonderful mother that loves her children no matter what, and is going to strive for them and make sure that she can take care of herself and them in the future. So she's doing wonderful.
At first I was like, I don't know how I'm gonna ever see the light. I didn't just realize how important mental health was for me. I realized how important it was for my whole family. I had a bucket full of artwork that I was scared to release. Lizette helped me. She was like, hey, I wanna see you get this stuff out there. And that really helped me break through that moment and be like, you know what, I can do this. And so I released it. I opened my Etsy business and I put it out there online and people can buy it. And I'm so proud of myself because that was something that I didn't think that I could do.
It was a bit rocky for her at the beginning, but that's how mental health is sometimes. It's a very rocky road, but it's gotten to the point where it's smoothed out a lot for her. She'll be able to go to a lot of different places with everything that she's been able to do. So I'm very proud of her.
Woven just really took me underneath its wing, not just in my medical health, but in my mental health, emotional health, my family relationships. It has truly, truly given me hope.
The last 2 years of the pandemic have taken a tremendous toll on our patients, both physically and mentally. We have seen the need for healthcare skyrocket. Chronic diseases like diabetes, high blood pressure, and obesity have spiraled out of control. Isolation, financial stress, and losing loved ones to COVID have increased serious mental health conditions. More of our patients are being diagnosed with severe depression and anxiety. We used to see one patient a month threatening to commit suicide. Now we see 2 a week. Woven Health has a unique, proven model. We all have both physical and mental health intertwined. By integrating mental health care with primary care, our patients are more likely to be diagnosed and get treated. Our holistic model, offering medications, on-site counseling, exercise and diet, helps our patients achieve improved health and overall a better quality of life. At Woven, 95 cents of every dollar that you give goes directly to providing this critically needed care. Without our clinics, many of our patients would not get any care at all. We need your help to keep our doors open and to expand the number of people that we can serve. Our patients and our community need you now more than ever. Everybody deserves the kind of care that Woven Health provides. And we are so grateful for each and every donor and supporter that has helped Woven Health build healthy lives and healthy communities. Thank you.